Okay, good afternoon. I'm Aryan. I will be demonstrating Glasgow Coma scale. This test is most widely used clinical scale that measures level of consciousness and help define and classify the severity of injury. We have three rating scales with an overall score of 15 is the highest and 3 is the lowest. The GCS total score from 13 to 15 indicates a mild brain injury, 9 to 12 indicates moderate brain injury, 3 to 8 indicates severe brain injury. And the patient CV scored 4 on eye opening, 3 verbal response, 6 motor response, and the total score of 13, which means she has a mild brain injury. But I will demonstrate the procedure on how to use the GCS. The procedure of eye opening assessment is scored from 1 to 4, and the most severe is 1 because it shows no response. If the patient opens eyes spontaneously without external stimulation, the score is 4. If the patient responds to sound, the score is 3. If the patient open eyes only on painful stimulation, the score is 2. If the patient does not open her eyes even in painful stimulation, the score is 1. Now next, motor response. If the patient following a command, the score is 6 points. Ma'am, I want you to lift your right hand towards your left shoulder. Very good. If the patient identify and move the stimulus away, the score is 5 points. If the patient withdraw on the stimuli or pull away the stimulated part, the score is 4. If the patient shows abnormal flexion by painful stimuli or decorticated posture, the score is 3. If the patient present extension by painful stimuli or decerebrate posture. If the patient does not present any motor response or reaction, even painful stimulus, the score is 1. Okay, next, verbal response. The procedure of verbal response is scored from 1 to 5. Here, we can create a conversation with your patient. And if the patient who is actively in normal conversation, the score is 5, which means the patient is oriented and can answer simple questions. How are you feeling?
I have a headache and I'm feeling nauseous.
If the patient is disoriented, the score is 4, which means she is confused. What is the day today, ma'am?
I think it's Monday.
Where are you right now?
I'm at home.
If the patient doesn't respond properly and responding randomly or words without meaning, the score is 3. What happened uh, during the accident?
My power down.
Okay. If the patient cannot participate in a conversation and responding incomprehensive speech, the score is 2. Ma'am, do you have relatives we can call? Okay. When there is no verbal response from the patient, the score is 1. Ma'am, hello. Where are we right now?